Hello everyone, my name is Jasmine, and today we're going to be talking about culture competence in dental care. The concept of culture competence in healthcare and its importance in dental care settings is that culture influences health and illnesses behaviors, such as pain. We see this in dental offices on our day to day, in classroom settings, even between families and friends, coworkers, depending on the tradition, beliefs that they have. In the foundations of diversity and multicultural competence, diversity is a broad term related to culture. Multicultural competence congruence behavior, attitude, and policies that come together in a system, agency, or among professionals and unable to work effectively in cross-cultural simulations. So adapting to assessments and treatments equals health quality and positive outcomes. Attitudes, behaviors, customs, and traditions have a lot to influence in diversity and multicultural. The impact of diversity on treatment acceptance is one thing that we don't really want to say come across because we come across it on our day to day. For example, I have a lot of family members who are Jehovah's Witness, which, as a lot of you may know, Jehovah's Witnesses do not take any blood transfusion. They reject that, even if it's they're in their deathbed and they need it. They reject any blood transfusion. Another example can be, religion, health, and healing come together and impact how treatment is accepted by patients. Some patients won't accept it because their traditions or, beliefs don't allow them to. The challenges and behaviors for diverse population are high among different diversities, different cultures, different populations. A lot of, cultures accept cavities on baby teeth. Why? Because they're going to lose those teeth either way. However, they need to get educated on the reasoning why it's important for those kids to keep their primary teeth healthy as well as their permanent teeth. Another example is, a lot of Midwestern diversity patients claim that, whatever you do or eat affects the child's teeth and how they develop, which in a way it does have to do a lot with genetics and stuff, but they have that mentality. And so a lot of the times, these patients are not accepting the treatment that is being recommended, and those are the challenges we face as clinicians because we have to really educate them. Another, challenge we face are home remedies. There's different types of beliefs, methods that culture, diversity, patients have, home remedies that compromise their health sometimes with like relieving pain and swelling, self medications with over the counter pain medications. And it's our duty to help those patients and communicate with them and educate them and kind of take down those challenges, that wall that is put up. Enhancing cultural competence in dental treatment modalities. So, always keeping in mind that there's new approaches and strategies to enhance culture competence in the delivery of dental treatment, including tell, show, do diagrams and videos, as well as images. In school, we were taught to really help patients with their education by telling them, showing them, and doing it. So, telling the patient how to do something, showing how to do it, and having them demonstrate to us what they have learned is a great strategy, great technique that we all should use. And diagrams, videos are my favorite. I'm a very visual learner. So all of that stuff helps me educate my patients. 6 keys that aims of quality considered fundamental to the provision of quality care are safety, timely, efficient, effective, equitable, patient-centered. Keeping that in mind when, enhancing culture competence in the dental treatment modalities are things to keep in mind. Culture competence in oral health educational. So, recognizing the structures that shape clinical interaction, developing an extra clinical language of structure, developing an extra clinical language, articulating culture fundamentals, observing and imaging structural interventions, developing structural health, humility. So, for example, being able to build that relationship with a patient and making them feel comfortable in, whether it's the chair, whether it's in a classroom setting, whether it's your family member, just making sure that you come across not with a defensive or argumental reasoning, just making sure that as healthcare professionals we educate. Culture, beliefs, traditions are okay to have. Nobody's against that. But if we can move away from that and actually bring up the facts, the, tips that as dental professionals we have that are effective and will help that patient kind of move away from traditions, beliefs, is going to be one of the biggest impacts. I'm a very visual learner, so I like to have a lot of videos, pictures, hands-on like Amazon, typodons and stuff, so that I can show the patients, educate them on what the benefits and the risks are with whatever tradition, belief, they have. Reducing health disparities through culture competence, recognizing positive experiences and attributes that facilitate wellness, center good relations with indigenous people, recentering power relationships and self-determination, attending to structured determinants of health. So really being there for that individual, centering around what help they need. A couple months ago, I had a patient. He was from, I want to say, Middle Eastern, and his daughter came in to translate. And when we were giving him the treatment plan and explaining, periodontal disease and all this stuff to him, he kept looking at us like, well, I just went to my Middle Eastern dentist and he didn't say any of this. So when we approached the daughter, we were like, there's different cultures, beliefs, traditions. We can't influence everything on that, if you want to put it that way. And she's like, I know, he's very stubborn. So when she said the word stubborn, in my head, I'm like, okay, so let's educate. We educated the patient. I sat him up, went over, numbers, x-rays, and I put up a video of periodontal disease where he could see what the bone levels were going down to and where initially his bone level was at. So if we can close that gap between, all these different cultures, diversity of patients, we're going to have less health disparities in a way and have more patients accept treatment, have more patients. It's all about communication and education. Implementing culture competence. Practical steps are learning about different cultures, being aware of culture differences, building rapport, acknowledging bias, promoting a positive culture, communicating with patients using the time, voice, facial expressions, and way of explaining are, practical steps to take. Training, workshops, and resources are available for self-improvement. I am on Cloud Dentistry and I love their CEs because not only are they about periodontal disease, about caries prevention, about child abuse, but they also talk about culture diversity, and there's a lot of CEs that help us as clinicians get informed and get updated with all the new stuff that's coming out. Ethical considerations and patient-centered care. Always, as healthcare providers, we are standing with our ethical principles that, we've learned. The importance of ethical consideration and providing patient-centered care for diverse populations, helping them ensure that they're getting the correct treatment with dignity and respect. We're also not going to, not value that patient as all the other patients. The need for informed consent is huge. Informed consents and notes are everything. They not only cover our butts, to say it that way, but serve as legal documents. You never want to not give an informed consent or, write detailed notes. Always take the time to write the detailed notes to give that informed consent. At the end of the day, it's their right, their privilege to have that information. So we have came to wrap up what I have presented, and the key points that I gave in my presentation were the foundation of diversity and multicultural competence, impact of diversity on treatment acceptance, challenges and behaviors for diverse population, enhancing culture competence in dental treatment modalities, culture competence in oral health education, reducing health disparities through culture competence, implementing culture competence, practical steps, ethical considerations, and patient-centered care. Overall, I've really enjoyed this course because I feel like it really goes with our day-to-day, dealing with either in clinical settings or classroom settings or even with coworkers, family members. You know, we come across with diverse patients, diverse people that have certain beliefs, certain traditions, certain cultures that they go by. And as clinicians and as human beings, we have to learn to respect and, communicate with those patients and educate them efficiently. I really love that we were able to, learn more about diversity and culture, and I really enjoyed this course. Thank you for watching. Presentation. Thank you for watching.